I'm Rebecca Badeau, and joining me virtually this afternoon is Dr. Dean Blumberg, a pediatric infectious disease expert at UC Davis Health. Today, we will be providing an update on COVID-19 and how to stay safe during the upcoming Labor Day holiday weekend. If you have any questions, I encourage you to please post them in the comments section. We'll try to answer as many of those as we can during our discussion today. But Dr. Blumberg, thank you so much for being with us once again on our Facebook Live.
Yeah, it's my pleasure. There's always something going on related to COVID, news every day, right?
Exactly. So since there is so much news coming out, can you bring us up to speed on, at this moment in time today, where are we with COVID-19 and the spread of the virus?
Well, there's still widespread transmission in the community in California and in Sacramento and in all of Northern California. But it has settled down a bit. So the R naught, that's the number, like how many people are infected from each case. If it's over 1, you're going to have a spreading of disease. Less than 1, meaning you have more control over it. It's finally fallen below 1 for California as a whole. And so we've seen decreasing cases from really the surge that we saw in July and most of August.
There's so much data and so many numbers and so many states with different reopening plans. With that below 1, you talk about California. Where does that put us? Are we close to moving to some new phase of what this may look like as far as normalcy, even though this is not normal?
I think so. What we can do is we can start considering opening things up. And so those are the discussions that we've been having. For example, we've talked about schools opening up. And the first thing you need to do before you open up schools is you need to have control of the infection within the community at large. Otherwise, we know what's going to happen if you open up schools, if the transmission is not controlled, is you're going to have increased spread of disease just because you're going to have increased contacts all around.
Well, and I think that history has proven that true, because you look at universities across the country, as soon as students came back, there were huge spikes in numbers. A lot of folks contributing that to some irresponsible behavior, some parties, maybe just people wanting to see their friends once again. But those types of behaviors, they're common. And they might be some of the behaviors that we're thinking of Labor Day. We want to see our family. We want to congregate. What's your word of warning there?
So we saw what happened after Memorial Day, which at the end of May, we were doing a very good job of social distancing in California. And then we relaxed some of the social distancing rules. And a lot of people didn't follow the advice at the time. They thought that the relaxing of the rules meant that there were no rules whatsoever. But the social distancing and the masking still were in place, and people were doing backyard barbecues and being out and about without masks, without social distancing. And what we saw is that led to the surge of cases in June and July and August, and got us to where we are now. Now we seem to have a little better control over it. And so we want to maintain that over Labor Day and other holidays. We want to make sure that we don't have large gatherings where people can't social distance and they can't mask. People need to social distance, and when they're out and about in public, they should be wearing masks. Those are the 2 most important things that people can do so that we can reopen more things and so that we can get back to our close to normal way of life.
I want to talk a little bit more about some Labor Day social gathering specifics in just a moment, but the terminology that's been used all the way back to March, pre-Memorial Day, was this whole idea of flattening the curve. Where are we now in terms of the California curve? I mean, is it flattened? Is it bowed? Where are we?
Yeah, so I think that if the R naught is at 1 or below, then that means we've flattened the curve. So we've done that. But that doesn't mean that we're out of the woods yet, because what we still do is we still have a high rate of transmission, even though it's not out of control. It's controlled, but it's steady. So there's still more than 100 deaths per day in California from COVID-19. So we still need to take this very seriously.
Do you think folks have become desensitized to that, or is it just fatigue setting in that we're about to mark 6 months since the first stay-at-home orders came, and people are just frankly exhausted?
Yeah, so am I. I'm exhausted too. I would like a vacation. I haven't gone on vacation since this all started. I'd like to get on a plane and go somewhere interesting. I'd like to do a lot of other things too. I'd like to go to sporting events and concerts, and that's just not feasible right now. And so it is very tiresome. But we have to keep the big picture in mind. And the big picture is the more we follow the social distancing and the masking advice, that means the less infection there will be, and that gets us that much closer to being able to do the things that we want and see the people that we want to see and have dinner with our friends or family.
I know back in those early days, we were hoping that, oh, maybe when warmer weather comes, it will kill it off. That obviously did not happen. And now here we come, rubbing salt in the wound of sorts that flu season is now upon us. So what are you telling people about flu shots? Should people get them? When should people get them?
Yeah, we were hoping that the warmer weather was going to result in less transmission, and it didn't. And that's because we had so much of the population, virtually everybody was susceptible to this new infection. Nobody had immunity. And so it really didn't change the transmission during the summer. And now fall is just around the corner, and winter and flu season. If we have flu and coronavirus going around at the same time, that could be a recipe for disaster. We don't know what would happen if you get both at once. Would it be synergistically worse? And we don't know how that could affect the availability of healthcare with doctors and clinics and healthcare workers being available. We want to make sure that we have the capacity to treat everybody who needs to be treated. And that's why both of these need to be controlled through the social distancing and masking. And for influenza, it's more important than ever. The influenza vaccine is your best protection against influenza. And so everybody should be vaccinated. Everybody 6 months of age and older should get the influenza vaccine.
Excellent advice. If you're just joining us here on Facebook Live, we're discussing COVID-19 and its implications on the upcoming Labor Day holiday weekend. Please post some comments, if you have questions in the comment section, and Dr. Blumberg will probably try to get to those in a minute. But okay, so let's talk about Labor Day weekend, Dr. Blumberg. It's the last hurrah of summer. A summer where most have been inside, socially distanced from loved ones, away from normal activities. You talked about wanting to take a vacation. Vacations have not been had. How can people stay safe during this upcoming weekend?
So social distancing and wearing a mask are the two most important things that people can do. So if you are socializing with people outside of your household, then make sure you're wearing a mask and you're socially distant from them. So that means at least 6 feet apart. So the most feasible way to do this is to do this in your front yard or your backyard. And when you're outside, there's much decreased risk of transmission because the volume of air is so large when you're outside that the virus gets diluted. When you're inside a house, the volume of air is more limited, and that means the virus is going to be more concentrated. Plus, if you're inside, there's less possibility of social distancing just because of the confines of the room. So set up a couple chairs in your front yard, in your backyard, make sure they're 6 feet apart, sit down, relax, keep your mask on, except when you're taking a drink or you're eating. That's the safest way to socialize during a holiday weekend like this.
Often we talk about the number of cars traveling on the nation's highways and freeways during this time. But if I'm hearing you correctly, traveling could be simply going from outside the confines of the immediate family members that you've been with during this time to even other family members across town. So do you discourage even that kind of travel at this time?
No, I think that's okay. And again, it's like you have much more ability to isolate yourself if you're in your own private automobile, right? Rather than going on public transit. So if your household gets in the car and drives across town and stays outside, socially distanced and with masks on for your friends or family, I think that's relatively safe to do. It poses some risk, but it's a very low risk. And I think we're all making compromises these days. And I think, from my opinion, I think that's a reasonable compromise. I would try to avoid large gatherings. Even if you're outside, if you're in a large gathering with 25 or 50 or 100 people, you just know that the social distancing is going to break down. That's just natural in that kind of situation. So I would try to keep it more of a reasonable number of people, 5 or 10 people.
I think also of an intergenerational gathering, kind of this last send off of summer before school begins. And of course, that involves children. So, what is the science telling us? It appears that children may be less susceptible or maybe asymptomatic. What do we know about kids in this virus right now?
So children aren't driving this. What's driving this now is adults, and it's really young adults have really increased in terms of the proportion of people who are infected. So we believe it's the young adults who are out and about, who are socializing, who then get it when they're out in public and they bring it home. In fact, when you look at outbreaks within households, 80% of the time it's an adult who brings that to the household. Only 8% of the time is the child the first one ill and then infecting others. So children aren't primarily driving this. They're less likely to be infected if they're exposed. And when they are infected, they're less likely to be symptomatic. That means they're less likely to cough or sneeze, and that means they're also less likely to transmit the virus. So this is really more of an adult disease, and they're really driving the transmission.
With that said, what are your thoughts about children returning to in-person school or even some sort of a hybrid solution this fall?
Well, we all know how important school is, and all this talk about opening schools really shows us how we value teachers, how we value the children learning in schools, and how we value the school environment also in terms of kids' socialization and social skills. So all those are important, and we'd all like to achieve that, but we need to do it safely. The first thing we need to do is control infection within the community. And then the next step is incrementally going back to school with smaller class sizes that are cohorted, so into pods, so that we can have adequate contact tracing in case there is an exposure at school. We need to have the adequate contact tracing, adequate testing available. And the state of California has put out some nice guidelines, and the American Academy of Pediatrics has some nice guidelines about specifically how to do that, how to achieve that. So I would imagine it would start off small groups of kids, part-time, and then and limiting their interactions with other pods within the school, and then gradually relaxing things and having more full-time. But we'd sure like to do that. It'd be beneficial for everybody, and not only kids, but of course working families.
Right, it goes both ways, because if we're being responsible for the children when they're in school, there has to be that the reciprocation of the family unit, the custodial unit, whoever's care that they are in, that they're following all those, practicing those safety guidelines as well.
Right, and let me just give you a couple of examples that show that this kind of thing can be done. So in Georgia, they had a summer camp where kids went to this summer camp, and in Georgia, the infection was not controlled. So there was a widespread transmission. When these kids went to camp, the rate of infection was astronomical. More than 50% of the kids ended up getting infected. So that was a disaster. They did the same thing in Maine when Maine had a very low rate of transmission. They had adequate contact tracing and adequate testing in place, specific protocols for quarantine and everything. And they were able to have people come from several states, even from out of the country, to this camp in Maine. And they just had a handful of asymptomatic infections that occurred. So we know that this can be done. We can have gatherings of children in one place if it's done right, and if there's control of infection within the community. We know we can have children go back to school safely. We just need to do it the right way.
We have a question I want to get to from one of our viewers. The question is, we're going camping and social distancing. Can COVID/flu travel easily across water? Should we stay farther away, or is that an old wives' tale?
So neither COVID nor influenza is transmitted by water. So I wouldn't worry about the water. We were lucky enough to get campsite reservations in Yosemite for next month, for October. And so I think it's safe camping. You're outside, the campsites are farther apart, you're able to socially distance, there's fresh air. So I think camping is safe. The biggest risk, I think, with camping is the bathrooms. But of course, the the campgrounds that I've been in, the bathrooms aren't completely enclosed anyway. They all have like screens and stuff. So they're kind of open air anyway, with a lot of air circulation. So I think camping provides a very nice recreational opportunity in these times.
And probably a mental health break too, just to get out and be among nature and away from the confines of what really a lot of people have found so constricting during this difficult time, right? The mental health part.
I'm looking forward to it being therapeutic, yes.
So speaking of bathrooms, and I'm going to go back to home gatherings. So you have your outdoor, your tables are situated, distanced, you've got chairs around, and you're in the front yard, but inevitably people have to use the facilities. So what are your recommendations as far as people going in and out of the home, be it a host or a guest at a gathering, for protocol for using the restroom?
So at the beginning, when we talked about how to most safely do this, I recommended doing it like in your front yard with your neighbors. And the ideally you do that because you could go home and use your own bathroom. So you wouldn't have to. Now, if you drive somewhere, of course, that's not feasible. So in that case, what we would recommend is for the host to designate one bathroom for guests and to really strictly adhere to one guest at a time going into the house, use the bathroom, and then coming out. Because we know you can't social distance in the hallways. And so we don't want a line of people in the hallways or people even passing each other in the hallways. But that would be the way to do it if you're visiting somebody.
Do you think it's best maybe for hosts of gatherings to maybe set some ground rules or even some friendly reminders? I know it's very helpful when you're out and about and you see the 6-foot lines, you know, in painter's tape or whatever on the floor. It may sound odd to bring it home, but if people are there and you truly love and care for them, I would think this would be a way to show that.
Absolutely. So set up the chairs at your home, set them up 6 feet apart. And if people start dragging them closer, discourage that from occurring. And tell people when they go in the bathroom, you can just say, here's what we're doing. We're only allowing one person at a time in the house to use the bathroom. You know, it's your rule. You don't want to be confrontational. And really, during this time, there has not been clear and consistent messaging. Even people with the exact same risk factors for infection who look at the same information might have different risk tolerances, and they might process the information in different ways. So that's why you do get people following a variety of different practices. And I think we all need to be tolerant of that.
So in light of the science, in light of states and who have gotten it right with certain things, states or instances, I should say, and in light of the fatigue that we're all feeling, what's your one big piece of advice going into this Labor Day weekend as we're approaching fall and what for many is usually the start of something new, but we're still in the same?
The two main things that you can do to protect yourself is social distancing and masking. Those are the two most important things by far. Covering your face, we know that that protects the person who's wearing the mask. We know that that protects others who they're coming in contact with. So it's protective both, it works both ways. Those are the two most important things by far. All the efforts that people make in terms of hand washing is good for like a lot of things. It doesn't protect much against transmission of coronavirus. And all the disinfection, the deep cleaning that you hear about, also it's, you know, the transmission by contact is very little, if at all. So the main thing is respiratory transmission, and that's why masking and social distancing are the two best things you can do to limit transmission, to keep yourself healthy, to keep your household contacts, your family healthy, and to keep transmission rates low in the community, which is a patriotic thing to do for our local communities so that we can get through this faster.
I want to get in. We just got a question. Can you talk about, because we're talking about masking and distancing, two big things that you say, the main things, which on the surface seem fairly simple, but what about something like a cotton homemade mask? How often should you be changing that during the day or washing it?
So I say masking because that's what I'm used to, because I'm in healthcare. So I go to the hospital, I'm wearing a mask, but the cloth face coverings are good also. And so wearing those cloth face coverings, any kind of thing to cover your nose and your mouth is appropriate. For the cloth ones, we do recommend to launder them daily. So you can wear them throughout the day. If they get soiled, if somebody coughs on them, and if they get wet, you should change to a different one. Otherwise, once a day is appropriate.
Okay, excellent. That's good. That's a good thing to know. Dr. Blumberg, thank you so much. You always provide such a wealth of information and very tangible tips that we can use to help stay safe and healthy during these times that we all acknowledge continue to challenge us. But I'm hearing your message is stay the course, remain vigilant, and don't give up and let your guard down now.
Right. Yeah. Stay healthy.
All right. Thank you. And thank you so much for your time. I want to thank you for joining our Facebook Live today. If any of this information, and likely a lot of this information, your friends and family will find useful, please share this link with them. And always, UC Davis Health offers a wealth of resources and information for you and your family during the coronavirus pandemic. You can log on to ucdavishealth.edu/coronavirus for the latest information. We wish you all a very happy and healthy Labor Day weekend. Be well.